Welcome back, group. I really appreciate all of the feedback I've been getting, a lot of great side conversations, which is excellent. But even more so now, I think we will be getting into some things that are more interesting and directly related to some of you. Moving away from some of the educational side stuff to some more of the clinical aspects and how we can make the most out of you guys who serve as some of our best preceptors and some of the experts from other fields, looking at how you balance both education with real hands-on clinical experience. And we know that our students benefit so much from that. So however we can help with that, that's what our real goal is to facilitate those clinical experiences that a lot of you guys provide for us. And so this first area that we're going to look at specifically is our clinical immersion, or we're starting to call it mentorship, because only some of it matches the strict definition of immersion. But this is for our final year students. And so they apply to be with a mentor. Right now, they're all at Augustana, but we're piloting some offsite options. And they're with that mentor or preceptor for the entire year. And the goal is for them to really get immersed in all of the different aspects of athletic training and focus on that transition to practice. So we know that students struggle transitioning from the role of student to the role of full-time athletic trainer. So we're trying to find a way to get them as involved as possible with the daily operations of athletic training. Students are required to get 600 hours of supervised experience over the course of their year, and then we also have some supplemental experiences that you can see as well. Some of the things that have worked so far is the students are really good at developing these relationships, right? Very natural relationships develop between preceptors and students that allow for them to gain a lot of these more semi-autonomous experiences as preceptors become more comfortable with the students they're working with. Naturally, they allow them to be more involved in the treatment aspects. And then they get to participate behind the scenes with all those different tasks that help them see themselves as practicing athletic trainers. The real struggle has been the demands of clinical experiences, either real or imagined by our students, and that affects the quality of their classroom work at times. We hear occasionally this idea of trying to please two masters. And then also with the growing program, this one-to-one ratio of students and on-campus core preceptors is not sustainable. So we're looking for any feedback with that. So I have included in our February 19th immersion experience folder the feedback form, that document I was just referencing, and then the syllabus if you want more information on that. Specifically on the feedback form, again, we have the normal overall thoughts and blind spots and highlights, but the special question for this period is looking at how to balance both education and clinical practice. And so what does that look like, in your field if it's different than athletic training? How did you go about doing that? What sort of things helped? If you've been a preceptor for individuals or different aspects like that, how do you help that? And how do we make sure we continue to give students the opportunity to be very involved in the clinical setting, but realize they have these additional duties as educational students and still being in an educational program? So as always, any feedback methods are there, whether you want to type directly into this document, whether you prefer to email me directly or just speak off to the side. I appreciate that. I'm taking notes with all of those sorts of things. Oftentimes you guys ask great questions that I don't have the exact answer to, and so I'm taking those back to our working group, and we will work on that. So thank you so much, and if you have any questions, please let me know.